Jugalbandi series. Today we're going to discuss about various forms of allergies. It could be allergic dermatitis or allergic rhinitis or allergic bronchitis or asthma. Now, what is allergic dermatitis? Many of us could have experienced a kind of skin itching, redness, bumpy lesions on the skin on exposure to certain items. Okay, this is called allergic dermatitis, and it can get triggered due to exposure of various things. It could be various allergens like soap, detergents, some liquids, some creams, or even like the foods like egg or peanuts or several foods can trigger these reactions, even several drugs. So this is called allergic dermatitis. The reason for this is mostly genetic. Any of the parents or the close relatives would be having such a reaction, or sometimes it could be environmental triggers. But mostly it is genetic, and the same person could also experience lot of sneezing episodes or running nose or blocked nose. This is called allergic rhinitis. Again, the triggers could be different. There could be environmental stimuli like dust or smoke or several particular fragrance, or even it could be seasonal change, and also some of the foods also can trigger these. The above mentioned food can also trigger these allergic rhinitis. And in the way similar, there may be people who have allergic bronchitis. Now, what is allergic bronchitis? It is predominated by wheezing, phlegm, and cough at night or early morning, which again is an allergic reaction triggered by the smoke, pollutants, or dirt, pollens, and sometimes the food articles. So, a person can harbor all these three allergies, or it can also separately happen in different individuals. So it depends. The reason for this is not explainable. However, why does this happen? When our immunity, is immune high, we call this immune hypersensitivity reactions. So this is mainly type 1 hypersensitivity reaction to that means the immune system it stages a heightened response to a particular allergy. So this allergen may differ from person to person. One person may be allergic to egg, or the other person may be allergic to some particular detergent. So first of all, we have to understand what is triggering this. Many a times it is difficult to understand even which allergen is triggering. So that time we go for an allergen prick test basically. So these are different triggers for these kind of allergy reactions. Now, how do we prevent this? Is it even possible to prevent these kind of allergies? Yes, we can definitely try to prevent this. So once we understand the allergen, we have to avoid exposure to that particular allergen. So it can be anything. It can be peanut, it can be dust. So we have to really use a mask when we are going out in a dusty area, or avoid peanut in your food. So it depends on the allergen that you are allergic to. Secondly, vitamin D. Vitamin D plays a vital role in preventing allergies. So we have to make sure we take a nice walk in the early morning sun, at least between 8 to 9 a.m. so that we get enough exposure to sunlight. So if there are clinically reduced vitamin D levels, so better go for a vitamin D shots for 2 weeks, once a week. And also we have to regularly exercise, which will help us improve the lung capacity and also reduce these allergies. And also yoga and pranayama also help in relaxing our mind, as well as taking a control of our breathing, etc. So, but there are what are the other treatment options available? One is for the allergic dermatitis, we prescribe something called as local antihistamines. So these are antihistaminic ointments or lotions. So if that helps, well and good. But sometimes you have to go for oral antihistamines like cetirizine, for example. If that is also not helping, then we have to go for steroids. And also there are some immunotherapy options. However, we have to avoid self-medication and definitely go to a doctor and take any of these medications under prescriptions. But try to avoid long-term usage of any of these medicines. So let's now try to understand the Ayurveda perspective of these allergies, and are there any therapy options available? Can we get a long-term relief? So Dr. Ramya, please explain.
Yeah, hello everyone. So, as Madam said, regarding allergic dermatitis in Ayurveda, it is often associated conditions with itching, what we call as kandu in Ayurveda, redness, inflammation, rashes, dry or oozing skin. Okay, so this is called as vicharchika in Ayurveda, or it comes under the category of tvak vikara, skin disorders. So this condition is mainly caused by the imbalance of three doshas in the body. As you all know, in Ayurveda, vata, pitta, kapha, imbalance in all leads to the inflammation, redness, burning sensation, as well as in when there is an excess vata increase in the body, contributes to the dryness and flaking and itchy skin. So additionally, the presence of toxins in the blood aggravates the skin issues and resulting in immune hypersensitivity. Coming on to the causes, see if you see the causes in dermatitis, right? That is vicharchika, consumption of incompatible foods according to Ayurveda. What we say, that is like if you mix milk with fish or sour milk, sour with milk products, excessive spicy or sour fried or preserved foods. Apart from that, poor digestion, excess toxin accumulation, stress and emotional imbalance, all these environmental and seasonal triggers like dust, pollen, chemicals, all these contribute. When coming up to the treatment for allergic dermatitis, right? So what we prefer is internal purification, what we call as shodhana therapy, especially virechana. This is considered as the best for all the pitta related skin conditions. Like it will help to remove the toxins from the liver and blood. Apart from that, rakta mokshana, that is bloodletting, this is also very much helpful for chronic and severe inflammation and itching. Apart from that, basti enemas to balance the vata, especially dry, scaly skin cases and all, we recommend this therapy. So generally in Panchakarma, Virechana and Rakta Mokshana and Basti, these are the therapies which we recommend depending upon the individual cases. Apart from that, there are many Shamana Ushadis, what we call as herbal medications for dermatitis, allergic dermatitis, that is neem, usage of neem, which is excellent anti-inflammatory and blood purifier. Manjishta, which is an excellent blood and skin detox. Apart from for itching and all, Khadira, and there are other Ayurvedic medicines which will help. And definitely there are certain external applications also, like Kumkumadi Taila or Triphala decoction. When there is a oozing lesions and all, you can pour those, wash with those decoctions. Apart from that, in Ayurveda, the major contribution what we call as diet and lifestyle changes, that is also definitely very important, like to avoid spicy, sour, fermented, fried foods, dairy products, which is a main cause for all the skin lesions, stress, daytime sleeping, all these things you need to avoid. And generally we recommend warm and easy digestible food, drinking turmeric water or neem infused water, that will help for the regular bowel movements and also help to eliminate the toxins. Apart from that, in Ayurveda, when it comes to Ayurveda, we link Ayurveda with yoga also, meditation to manage the stress. Apart from that, when it comes to allergic disorders, we can also see many together, like with allergic rhinitis also. This is also considered as a tridoshaja imbalance in the body, which we call as pratishaya. That is a type of nasal allergy caused by the imbalance of vata and kapha doshas in the body. So how it gets triggered? It gets triggered by the exposure to allergens like dust, pollen, pollution, cold weather. Generally it gets worsened when the body immunity levels are less, and poor digestion and toxin accumulation. So generally we see the symptoms like recurrent sneezing, running, blocked nose, watery eyes, itching in the nose, eyes and throat, and throat region. Okay, this again, the causes of allergic dermatitis, allergic rhinitis, all are almost same, where exposure to cold, heavy, dairy rich foods, weak digestion, seasonal changes, suppression of natural urges, all these contribute. And again, in when it comes to rhinitis, the Ayurvedic treatment is little different when compared to dermatitis. In rhinitis, we generally suggest Vamana in Shodhana therapies, which will remove the excess kapha and clear the sinuses. Apart from that, Nasya therapy is also very much recommended with the usage of Anutailas and all, which will help to clear the nasal channels. Apart from that, Dhumapana, what we call in Ayurveda, that is herbal smoke inhalation, which dries the excess kapha and opens the airways. And definitely when there is mild aggravation of these symptoms, we prefer Shamana Aushadhis also. Like there are good immune supportive detoxifying herbs in Ayurveda like Trikatu, Haridra, Sitopaladi Churna. All these anti-allergic and bronchodilators are very much useful. And also we give Ayurvedic like Chawanprash and all to boost lung health and immunity. Definitely, again coming to the diet and lifestyle modifications, this is very much important in rhinitis, because you have to to clear the blockages and all, you have to practice yoga, that is pranayama, anuloma viloma, which is very much helpful. Apart from that, Brahmari is also helpful in yoga, in the pranayama. Apart from that, steam inhalation, warm herbal teas like ginger, tulsi tea, light meals, all these contribute. Then moving on to the major this thing what we call as allergic bronchitis. So this is we do have a very good treatment aspect in Ayurveda. We call it as one of the Shwasa Roga, which is called as Tamaka Shwasa in Ayurveda, where there is a dushti of Vata and Kapha along with Ama in the respiratory tract. So it occurs again when like allergens with the dust, smoke, pollen, which trigger inflammation and mucus buildup in the bronchial tubes, causing breathing difficulty, coughing and chest congestion. So again, symptoms what we see is chronic or dry wet cough, wheezing, breathlessness, chest tightness, excessive mucus or phlegm, fatigue and reduced respiratory function. When again coming to the causes, we all three we can club together, because in Ayurveda we see our body as a full one whole organ which are all interlinked to each other. One that is the reason we can see the same symptoms and causes when we see with allergic bronchitis, allergic rhinitis and allergic this eczema this all these conditions. But when coming to the treatment approach, little variations will be there. Again in Tamaka Shwasa, in Ayurveda, in the classic itself it is told as Tamaketu Virechana. Means Virechana, this therapy helps to clear the pitta and toxins from the liver and intestines, reducing the inflammation. And in Vamana, again Vamana is also recommended, which will help to expel the excess kapha, phlegm from the chest and the stomach. And apart from that, Basti treatment is also very good, which is helpful in help to expel the dry cough and spasms. Again, Nasya also plays a very good role in the Tamaka Shwasa, where there is a mild bronchitis, you can suggest this therapy. It will help to clear the sinuses, improves airflow through medicated oils like Anutaila. Okay. Apart from that, when there is a mild increase, definitely Shamana Aushadhis also play a very good role, like herbs and formulations made up of Haridra, Pippali, which rejuvenates lung and boosts the immune system. Apart from that, definitely breathing exercises are recommended, steam inhalation with eucalyptus or ajwain. Apart from that, ginger, tulsi tea. So if I tell, Ayurveda treats all these allergic bronchitis, rhinitis, sinusitis, everything by clearing the excess kapha, ama, and tridoshaja balance, and strengthening the lungs and restoring the doshic balance through detox, herbs, and lifestyle adjustments. Thank you.
Thank you, Dr. Ramya. And also to add on, I forgot to add allergic conjunctivitis. So that is also very common in specific seasons. So many of the people who experience the above three also experience allergic conjunctivitis, which is like associated with lot of itching in the eye, itchiness, redness, sometimes watering as well. So again, the same factors, the triggers play a role in allergic conjunctivitis. The treatment also is in the same lines of giving a topical antihistaminic means and then followed by topical steroids. And I am sure we should try to root out these as much as possible rather than sticking to temporary medications. Yeah, thank you. Also, let us know in the comment box if you are experiencing any of these allergies. How do you try to manage it or prevent it?